Hi, my name is Emily, and we're here in the outpatient rehab department at University of Maryland, Upper Chesapeake Health, and we're going to be talking about osteoporosis. Osteoporosis is thinning our bones as we age. As one is 1 in 2 women and 1 in 4 men over the age of 50 will break a bone due to osteoporosis. We're helping people manage osteoporosis through exercise, rehab, and physical therapy. We're here with one of our patients, Terry. Hi, Terry. Thanks for being here. Sure. Terry was diagnosed with osteoporosis and began coming to physical therapy here as part of her treatment. Terry, do you mind telling me and the audience a little bit about your story and how you found out you had osteoporosis?
I would be glad to, because I think it's important. I was 62 and I was very healthy, very active, great diet, but I read an article on osteoporosis. It had the risk factors and I said, oh, I have that. My mother did that. Broke her hip. And I decided to ask my OBGYN, hey, do you think I need a bone scan? And she said, okay. I mean, she wasn't like, great idea. And days after I had my scan, I was told that I have osteoporosis. So then I began treatment. So I do want to say it's really important for us to be an advocate. Don't wait till the doctor says, do you want a bone scan? If you feel like you have the risk factors, it's important to speak up for yourself.
Yeah, I agree. Being an advocate in your own care is very important. So this is Megan, physical therapist. She's a physical therapist specializing in osteoporosis rehab, helping people strengthen their bones and increase bone mass.
Balance is super important because your bones are already porous, and meaning that they're at risk for breaking even on very low impact. So we want to avoid falls, and the best way that we can avoid falls is to work on our balance. So we do a couple of balance screenings while we're in therapy, but one of them is just balancing on one leg. And what we want to look at, go ahead and take a step forward, Terry, is if you can balance on one leg for 10 seconds. Go ahead and lift one leg, your dominant leg, good. And we want to make sure that someone can balance for 10 seconds, because if they can't balance for 10 seconds, they're at more risk for falls. And we use this test as well as some other tests to kind of get a big fall risk picture on each person. Very good.
10 seconds.
That was more than 10 seconds. So what we want to do is we want to work on balance at home or anywhere. Really, I say to my patients, let's go work on it in the grocery store when you have the cart and you're waiting in line. You can just sit there and balance. See, I'm not even that balanced. But you can stand there and just at the cart in the grocery store.
I do and brushing my teeth.
That brushing your teeth is even just as good as anywhere, okay? So then the next thing we like to look at is balance. And we're really trying to avoid the humpback posture that can be seen in the later stages of osteoporosis. So what we want to do is we just do a quick postural assessment. Go ahead and put your back up against the wall. And what we do is we want to look to see how far somebody's head is from the wall. She has to tip her head back to get there. She is just about maybe 2 centimeters, and anything greater than 4 is actually increased risk for spinal fractures. So you're actually doing really well. But what we want to do is we want to work on, go ahead and take a step forward, on strengthening these upper back muscles. So I'm going to show you one exercise that we typically give our patients to help strengthen the upper back. Come on over here. So these are just TheraBands, and you can get them anywhere, Five Below, the Target, Amazon, and they come in different resistances. But one of the exercises that we typically give to strengthen the upper back is what we call a mid-row. And what she's going to do is she's just going to pull them straight back, squeezing her shoulder blades. Go ahead and do that 20 times. Good. So we work on this. Very good. How's that feel?
Good.
Good. So this is just one exercise that we give patients for posture to help with that. Go ahead, you can drop back. Another thing that we work on for strength is, we're going to come and sit over here. And this is also helps with balance, is to be able, I'm going to come on this side, is to be able to get up from a chair without arm assist. And I know that Terry can do this because we've been working on it. Go ahead and stand up for me. And being able to stand up and sit down. And we actually use this for an exercise. So really one thing that you can work on right away is just being able to get up and down from any chair without arm assist. I say get up and down from the kitchen table or your dining room table without that assist, and that helps strengthen your legs. Exercises for osteoporosis that help increase bone density is weight-bearing exercises. Those are exercises that you're actually standing up for. So walking, dancing, low impact aerobics, all of those are weight-bearing exercises. Even the elliptical is a weight-bearing exercise that's non-impact that helps build the muscles and helps strengthen those bones that we can do from a physical and mobility standpoint. So those are things that you want to do at least 5 days a week, some sort of cardiovascular exercises, walking, even running, as long as your balance is good, because we want to make sure you don't fall. As well as then we want to strengthen 3 to 5 times a week as well. There are a few exercises that you really do want to, or things that you want to avoid. You want to avoid forward bending at all. So picking those items up off the ground like this is terrible. You want to make sure that you squat down to pick things up. A good thing to pick up is a reacher or grabber so that you can just easily pick things up off the ground, and that just helps keep you safe. Other things to avoid are jerky, twisty movements, so you don't want to do any of this, and that is super important because it increases spinal compression, and which could lead to fractures in your spine, and those are not good. So a big way that happens is sometimes with lifting, and I just want to review safe lifting techniques because everybody could use a little brush up on that. So we have something on the ground, and the big thing with osteoporosis is we don't want to bend forward to pick it up. We want to get a nice wide base, and we want to make sure that we bend at our knees and then come down to pick it up. So you're going to squat down, keeping your back straight, and then pick it up. And you want to keep it as close to you as you can. And then we're going to walk it over here and then turn around. And then you're going to put it right down. Good. You want to get close to it, and you don't want to go like that. That's bad because that's twisting. But you did that very well. Very good.
With your help, thank you.
You're welcome.
Awesome. So we're going to move this back over here, and I would like to introduce Ben Diffenderfer. If you'd like to come in, please. He's our physician assistant at Upper Chesapeake Orthopedic Specialty Group. Hi, Ben. Thanks for being here.
Sure. Thanks for having me.
Ben, can you share a little overview of our osteoporosis clinic, please?
Sure, certainly. So I have a very unique opportunity working in the orthopedic office because we have a very easy job in recognizing some of those patients at highest risk for osteoporosis, those patients with a fracture. Certainly they come in, we manage their fracture, and it's very easy for us to recognize them and direct them to the osteoporosis clinic for evaluation. We try to partner with lots of our local community offices for referrals to recognize these patients and get them dialed into treatment. Partner with the physical therapy group and other providers in the community to help manage treatment for these patients, because certainly coming to see me and getting on a medication is only one piece of the puzzle, but certainly working with the therapy group here to work on balance and posture minimizes your risk for a fracture. And I tell all my patients that, my goal is to prevent you from having another fracture or even your first fracture. Certainly if we can partner with the therapy group and prevent you from having a fall, chances are pretty good that we're going to prevent you from having a fracture. Well, there are several risk factors, and certainly some of them are a little more common in this area where we live because, the northeast region of the U.S., people have a higher incidence of vitamin D deficiency. So it's certainly important to make sure you're getting an appropriate amount of vitamin D. Certainly age is always a factor. There are several other factors that, in a female specifically can affect hormones. Maybe if you had early menopause or if you had other factors affecting estrogen levels as you were growing, or even after adulthood, they certainly can affect your bone health dramatically. Certain things like certain medications for diabetes or anxiety, depression, seizure disorders, as well as even common medications that you take for like acid reflux, like the proton pump inhibitors can put you at a higher risk. Certainly the one risk I mentioned previously that we have the unique ability to recognize is fractures, because having a fracture puts you at a much higher risk category for having another fracture. That's why we talk a lot often about secondary fracture prevention, because any individual over the age of 50 that suffers a fracture from a low impact trauma, such as falling to the ground from a standing position, puts you in that higher risk category where you would want to get screened. Prevention of osteoporosis really would involve making sure you have good healthy diets, good vitamin D levels, making sure that they're appropriate, but also regular exercise, because of one of the most important things to maintain and build good bone strength is regular weight-bearing exercises. Bones get strong and stay strong the same way muscles do. We all know you need to go to the gym, you need to lift weights to get big Popeye muscles, right? So your bones function very similarly. They need resistance, they need stress in order to stimulate growth. If you become sedentary and you sit around all the time, your bones are going to get weaker, just like your muscles will get weaker. Well, we certainly invite anybody to contact the office if they have any questions. Certainly, the referral process would only be dependent upon your specific type of insurance. We have signage up around the hospital that encourages patients to contact our office if they have any questions, speak to their primary provider, who would be able to initiate the workup process and get them dialed in to our clinic if they felt it was appropriate. But certainly if you have any interest, you can contact the office via phone or look at the website.
Yep, which I will share. So if you're interested in this clinic or think you might be a candidate, please visit our website at umuch.org/rehab, or you can give us a call, just like Ben said, at 443-643-3980. Thank you.